Again, Nan. Okay, thank you. So I will introduce our first presenter. We've got Gail Calthrop, who is a mindfulness lead practitioner and registered nurse at St Michael's Hospice in Hereford, and she's going to be presenting a case study for us today. So I'll hand over to you, Gail. Thank you.
Thank you, Rachel. Hello, everyone. As said, my name is Gail, and I have worked at St Michael's Hospice for 22 years. First as a staff nurse. I worked previously at a hospital in Hertfordshire. And as my journey with palliative care carried on, I worked out that I needed some help, and mindfulness popped in just at the right time. So I qualified as a mindfulness teacher with a company called Breathworks back in 2014. And from there, I developed a full program of all kinds of mindfulness offers. So the patient I want to talk to you about today is in some ways presents very much as most palliative patients do, that they arrive and they have a long history of associated traumas. They've been on a long journey, most of them, and so we are already dealing with how they feel about what is happening to them now. They've had setbacks, they've had hope, they have ongoing treatments which affect them on very many different levels. And that's without even thinking about any previous traumas that may have happened in their life, which I've yet to meet anyone who hasn't had some kind of trauma in their life. This palliative part of their journey is very much, for me, about symptom control on many levels, and on about, so where is the joy in their life at the moment? How is it being impacted? So I have found that I see patients first, quite often as outpatients, then as inpatients, perhaps in specialist groups, and then I often work with the family. In this particular case, this lady presented, 72-year-old. She had a very rapid diagnosis and a very short amount of months given to her. She had radical surgery, which left her with poor eyesight, neuropathy, and unstable atypical diabetes. She had been a very active lady, had quite a big family, or has quite a big family, and really felt one of her first sentences to me was, "This is just a continuation of my life and everything, how life relates to me." So that did give me an inkling that this wasn't only about the illness and about everything that's happened to her. Statement she said was, "I've always been unable to be okay." And that gave me a good opening of, well, what does okay mean? And that's when we began to explore what okay in the now is. She was interested to know more about mindfulness and what this sense of now feels like. She presented with anxiety, shortness of breath, fatigue, pain, and stress. Not uncommon, obviously, with her diagnosis and prognosis. Over 11 sessions, and in fact, I'll be having a 12th one with her soon, that lasted between 30 minutes and an hour long. We explored that sense of what the present moment feels like. I don't work with that we must go back or we must go forward. It's about creating that space of what now feels like. We explore the physical, mental, and emotional sensations and feelings. I usually preface, but not always, the meeting ups with using SAFE, one of the many trainings, SAFE, finding a safe space within the session, i.e. something that you look at, something that you sense, i.e. your feet on the ground or the warmth of your hands, something that feels okay. It may even be a safe memory, but that is her go-to. And if she's feeling well enough, we do 1, 2, 3 shake and heart hug. So this, for me, and then for her subsequently, is creating a space where she feels okay. We start the sessions with talking about now. Actually, how do you feel right now? How has the week been? What's been happening? And over a period of time, she began to explore what she called her specialist area of despair. Despair at how life has been, how it is now. That comes, of course, along with anger and frustrations, and how that actually feels in her body. She hadn't associated that anger and frustration actually lives within, say, her lower back. For her, it was very much in her shoulders and the fact of holding her neck rigid. And that whilst she can acknowledge that she does have pain from her disease, the holding of feeling angry, both at the pain and anything else, she is able to let go of just a little. Where this became most revelationary for her, and actually for me, it was wonderful for me to hear, were these moments of clarity when she said that being in the body during the body scan creates a rumbling, an awareness of what's actually going on, not what her mind is always telling her is going on, whether that is going to the past or to the future. She now understands that her anger that she is feeling, if she allows herself to come alongside it with that softening, quite often using the breath, that breathing in and that breathing out and allowing, can soften around it. It may not get rid of it, but that's okay. And that acceptance of, well, actually, it was probably pretty valid, wasn't it, to feel cross about X, Y, Z. But how about let's giving it some soft edges so that it reduces what you're feeling. And her comment then was, I feel such relief at letting go again and again and again, a loosening into my body. When we were there, that was about session 6 or 7, she felt able to explore the underneath of that anger. She said that being and feeling safe within the body scan particularly, and I did give her some adjunctive mindfulness activities which could take her there if I wasn't around, that she could explore what this anger, the underneath, felt like. She referred to it as the underneath. And she said, I woke up in the middle of the night and I suddenly realized that I wasn't angry with my daughter for not being or doing whatever it is I expect. I was really, really angry with my mother. And that my mother was the source of my anger. I was able to come alongside that anger. She didn't use those exact words, and that she could realize with a relief that it was not her daughter and it wasn't her daughter's fault. And that allowing, that lessening into the anger allowed her then to speak to her daughter and explain a little. It's work in progress. She felt that she then applied that to everything. So the toilet seat, she said, I was so angry with the toilet seat for being too high. And then I realized it's an inanimate object. I'm actually just angry that I am ill, that I am sick, that this journey is coming to an end. She also talked about that she realized that her pets, they weren't trying to annoy her or irritate her when they wandered around her legs or meowed too loudly or wanted to go for a walk with the dog. They actually were showing love and devotion, and she felt she could open to that love and devotion. So she felt that real easing of the space of where she holds so deeply. Coming alongside with that love, she then felt the protection. And she alluded to the protection as being the things that she didn't get from her mother, the things that then eluded her all of her life, and yet really they didn't. This was applied for her mother and not for the rest of her life. It was very touching for me to hear her talk about this, and that she said, "You've opened my eyes to the joy of living, and I'm going to live my life now." And she said, "I love the loveliness of now." So thank you.
Thank you very much, Gail. That's